Yeah, good day, everyone, and a warm welcome to everyone who's joined us today in this session. My name is Achieng Otieno. I work with the Kenya Tobacco Control Alliance. I handle issues digital advocacy and communication, and I'm glad to be your moderator today. Again, I wish to welcome you all to this second session of day 2 of the first African Conference on Tobacco Control and Development. We are glad that you found time to join us today in this important session. This will be an oral session, and the presentations are pre-recorded. We'll have different resource people who are going to be sharing. And then thereafter, we shall be having a question and answer where participants, we will welcome you to ask questions on the presentations that will be presented. So I can see our time is much spent, and I would wish to start the session. We know tobacco is a global epidemic. And in fact, in Africa, it's proving to be a major challenge. So today's session will be very important, listening to different experiences from our presenters who are going to share on their findings, research findings. And as participants, I'm sure we are going to get vital information that is going to inform our day-to-day work, even as we push for tobacco control in Africa. I'll begin by introducing the first speaker. Our first speaker is Dr. Shwesan Dai. He is a postgraduate scholar who works at the Institute for Metrics and Evaluation at the University of Washington. Dr. Dai will be presenting on the patterns in smoking and attributable burdens in Africa. Kindly play the video.
Hello, everyone. I'm Xiaochen Dai, a postdoctoral scholar working at HME University of Washington. Today, on behalf of our team, I'm presenting our results of patterns in tobacco smoking and attributable burden in Africa from 1990 to 2020, based on results of GBD study 2020. This is a list of our team members. Our GBD tobacco team is led by Dr. Gakido. Before the presentation, I'd like to thank the whole team for their contribution to this work. We know that timely evaluation of smoking patterns and attributable burden is essential to inform local, national, and regional level tobacco control responses. However, there's limited evidence on trends and level of smoking and its attributable burden that are comparable across all African countries. This study aims to generate rigorous, up-to-date, and comparable estimates of smoking trends and attributable burden by sex and age group in all African countries from 1990 to 2020. We hope that our estimates can inform resource allocation, prioritization for tobacco control efforts, and facilitate future tobacco-related research in Africa. In this study, smoking is defined as currently using any smoked tobacco products on a daily or occasional basis. To produce the smoking prevalence and burden estimates, we first conducted systematic review of literature on prevalence and relative risk of smoking using GHDX and PubMed. We then estimated the trends of smoking prevalence by age and sex using spatial temporal Gaussian process regression, or STGPR. STGPR is a 3-stage estimation process which is widely used for GBD estimates. After that, we re-estimated relative risk curves of 36 smoking-related outcomes for both current and former smoking using Mr. BERT. Mr. BERT is a new methodology developed by HME colleagues for meta-analysis and has numerous advantages over the traditional random effects model. I'm putting the citation for Mr. BERT here in case someone is interested. So this This re-estimation of relative risk curves are the key innovation for GBD 2020. Once we have the estimates of prevalence and relative risk curves, we use a direct estimation approach to calculate attributable burden of smoking. And lastly, we explore the association between countries' smoking prevalence and social demographic index. Social demographic index, or SDI, is a composite score of incomes per capita, average educational attainment, and fertility rates. For this analysis, we included 373 representative surveys in Africa and 727 studies reporting risk of smoking on any of the 36 health outcomes. Here is a map showing the data coverage of representative surveys. We can see that South Africa, Kenya, Egypt have the most data sources, while South Sudan, Central Africa, and Angola have the least data sources. In 2020, there were over 107 million current smokers in Africa, among whom around 88% are males. Djibouti and Tunisia have the highest smoking prevalence of around 24%. Lesotho and South Africa have the highest rate of dailies among males and females respectively. Between 1990 and 2020, most African countries saw a decrease in smoking prevalence for both sexes. However, there were still 8 countries showing increasing trends in smoking prevalence, and the number of current smokers had increased in all countries over the past 30 years, which is probably due to population growth. Here are plots showing the trends of numbers of smokers by age group. The left panel is for females and the right panel is for males. We can see that the number of smokers have been increasing across all age groups from 1990 to 2020, especially for young adults. In addition, the largest proportion of female smokers are 15 to 19 years old, which is quite concerning. These maps show the rate of deaths attributable to smoking per 100,000 population. DALY stands for disability adjusted life years. On the left panel is the map for men, and on the right is the map for women. We can see that health burden due to smoking is significantly higher for men than for women. Geographically, Northern and Southern Africa have the highest burden, while Western and Eastern Africa have the lowest burden. This plot shows a mild positive correlation between SDI and age standardized smoking prevalence. Although this is a crude relationship, it shows that African countries may face smoking control challenges in the future as the economy and society continue to develop in the future. The major limitation of this study is that the smoking status is exclusively self-reported, which suffers from the self-reported bias. In addition, there is no or very little data on smoking for some countries. So here are some key takeaway messages. First, data on smoking in Africa have been scarce in general. Although smoking prevalence has been decreasing in most African countries, the number of smokers in Africa continues to increase. Third, smoking is more prevalent in Northern and Southern Africa than in other subregions. Fourth, young smokers, particularly young female smokers, are on the rise. Lastly, higher social demographic index tend to be associated with higher smoking prevalence, suggesting that economic and social development may lead to increased affordability of smoking products. Therefore, tobacco control policies such as tobacco taxations are important as countries continue to develop. Okay, that's all. So if you have any questions or comments regarding this presentation, you can contact me via this email address. Thank you very much.
All right. Thank you, Dr. Dai, for that wonderful presentation. And indeed, it's a concern that the number of smokers in Africa is on the rise, and a lot needs to be done. So thank you once again for that presentation. And I wish to remind the participants again that if you have a question, feel free to share your question on the chat, or you can also use the Whova app to post your comment or your questions. At this point, I would wish to invite our next speaker. Our next speaker is Dr. Moyosore Osoba. He's going to be speaking to us about the electronic cigarette use. Sorry, let me look at this again. He's going to be speaking to us about electronic cigarette use among adolescents and the young adults in Nigeria. So I'll kindly play the video.
Good day, everyone. I am Dr. Moyosore Osoba, and I'll be presenting a research article which is titled Electronic Cigarette Use Amongst Adolescents and Young Adults in Nigeria, Prevalence, Associated Factors, and Patterns of Use. This is the outline under which I'll be discussing this topic. By way of introduction, electronic cigarettes are battery-powered devices that provide vaporized nicotine and recreate the sensation derived from smoking the conventional cigarettes, but does not involve the use of combustible tobacco. Electronic cigarettes are rapidly becoming popular, and recent studies have shown that electronic cigarettes have had a steady rise in recent years. In fact, in the United States, between the years of 2011 and 2018, there has been a 14-fold increase in the use of electronic cigarettes amongst young people. Some electronic cigarettes contain nicotine, and nicotine has been associated with adverse mental health when used without supervision. So given the adverse mental health effects that can be derived from nicotine use, we identified a gap in the literature on the relationship between electronic cigarette use and anxiety levels amongst adolescents and young people. So this study aimed to assess the prevalence and factors associated with electronic cigarette use amongst young people in Lagos State, Nigeria. Additionally, we also investigated the relationship between electronic cigarette use and anxiety amongst adults, young adults and adolescents in Nigeria. So for the study design, it was a cross-sectional survey, which was conducted between December 2020 and February 2021. And the study participants were in-school adolescents and young adults aged 15 to 35 years. We employed a multi-stage sampling technique, which involved the use of the simple random technique to select schools, that's secondary schools and universities in Nigeria. And then we also used cluster sampling to select class groups within this pre-selected institution. For the data collection tool, we made use of SurveyMonkey, and the questionnaire was divided into 3 parts. In the first part, we obtained demographic information on the age, gender, sex, education, and alcohol consumption of the respondents. In the second section, we asked questions about electronic cigarette use and other tobacco products use, and also quit attempts and the use of tobacco products by friends amongst the respondents. In the last section, we used a 7-item generalized anxiety disorder scale to get information on self-reported symptoms and the severity of anxiety. So for scores that fell between 0 to 5, they were considered normal anxiety levels. For scores that fell between 6 to 10, they were considered as mild anxiety levels. And those that fell above or on 11 were considered as moderate to severe anxiety. Statistical analysis was done using Stata, and we used bivariate and multivariate logistic regression analysis to identify factors which were associated with electronic cigarette use. For our key findings, a total of 947 respondents successfully completed the survey, and the mean age of the participants was 23.36%, plus or minus 3.97 standard deviation. And most of them were between the age bracket of 18 to 24 years. We also found out that about 28% of our respondents reported a history of alcohol consumption intake. A majority of our respondents on the prevalence of electronic cigarettes use had heard of electronic cigarettes. However, only a quarter of all the respondents actually recognized images of electronic cigarettes, which were drawn from social media posts. About 51 in total respondents reported ever using electronic cigarettes, out of which only 6 of them were current users. And by current users, we refer to those who had used electronic cigarettes in the past 30 days. And 45 of them were former users. That is, it has been more than 30 days since the last time they used electronic cigarettes. On the pattern of use, we found out that among the participants that used electronic cigarettes, about 41% of them reported a lifetime use. That's the total number of days they had spent using electronic cigarettes to be 2 to 10 days. And only very few of them, that's 3.92%, reported using it for more than 50 days. A majority of our respondents in general reported using electronic cigarettes at home. Furthermore, we also found out that among the electronic ever users, cigarette users, that's the 51 respondents, 9.8% of them reported an intention to quit, while 17.64% of them reported an actual quit attempt in the past 1 year. On the association between demographic factors and the self-reported anxiety levels, electronic cigarette was reported predominantly by respondents who were greater than 18 years of age. And most of the participants reported normal anxiety levels. That's GAD score between 0 to 5, regardless of electronic cigarette use. We also conducted by a very logistic regression model, which showed that an increase in age in participants associated with higher odds of self-reported electronic cigarette use. In all, we found out that anxiety levels were not significantly associated with electronic cigarette use. For factors associated with electronic cigarette use, we found out that alcohol use, a history of friends who used e-cigarettes, and current use of other tobacco products and substances were significantly associated with electronic cigarette use. On the limitations of this study, firstly, the study was a cross-sectional design which did not permit us to establish a temporal or causal relationship between electronic cigarette use, socio-demographic factors, and anxiety. Also, the data from the respondents were self-reported and they were not directly measured, which gave room for the possibility of social desirability bias, given the fact that we are in a socially conservative setting in Nigeria. From this study, we found out that the findings from this study can actually help to influence the monitoring of trends, as well as inform tobacco regulatory policy and tobacco control campaigns in the country, so that we can curb the use of electronic cigarettes and other tobacco products amongst young people. Thank you.
Oh, thank you, Dr. Osoba, for that insightful presentation. Indeed, it's worrisome. With a prevalence rate of 53.59 for the electronic cigarettes, and it's perceived in Africa as a new product. We need to be worrisome about this, and policymakers need to take note of this. Again, I remind our participants, if you have any questions regarding the presentations that have been made, kindly feel free to share them on our chat section, or you can also use our app, the Whova app. Kindly just make use of it. You can share your comments or your questions. And I'm also glad that our presenters are also responding to some of these questions on the chat. Thank you so much. Without wasting more time, let me get to the next presenter. Our next presenter is Ms. Joyce Nachitende. She's from Uganda. She's a Master's of Public Health student at Makerere University. She'll be presenting to us on the predicators of persistent tobacco use among the youth in Bwaise slum, Kampala, Uganda. Kindly, let's play the video.
My name is Joyce Nachitende. I'm a Master of Public Health student from the School of Public Health at Makerere University, and I'm one of the grantees of the Tobacco Control Research Agenda grants from the Center for Tobacco Control in Africa. My research was about assessing the predictors of persistent tobacco use among the youth who dwell in Bwaise slum in Kampala, Uganda, and it was a mixed method study. So what was the brief background about this study? We all know that tobacco use is strongly associated with non-communicable diseases, and these are on the rise in sub-Saharan Africa. And in Uganda, the number of the youth who currently use tobacco triples that of the adults. And of particular interest are the slum dwellers, because these have registered higher prevalence of tobacco use than elsewhere. We've had quite a number of interventions that have been implemented to control the use of tobacco, but we have not seen any significant decrease. In this study, therefore, we sought to assess the predictors of persistent tobacco use among the youth who dwell in Bwaise slum in Kampala, Uganda, together with the cessation barriers. So what methods did we use? This was a cross-sectional study, and it utilized mixed methods of data collection. 18 to 30-year-old youths were enrolled, and there were 422 in number. They were recruited systematically from their households, and structured questionnaires and interviews were used, and this data was analyzed both in Stata and Atlas TI, and the results will be triangulated. Firstly, I'll mention that these are partial results that I'm sharing, focusing mostly on the quantitative aspects. The qualitative aspects, once completed, will be triangulated with the quantitatives to have a complete results. So from the quantitative aspects, we had the prevalence of tobacco use as 52.6%, and the mean onset age for tobacco smoking was 17 years, plus or minus 3.9. And the most commonly smoked substance was termed as chibanga. It's a local term that is used to mean a mixture of tobacco and marijuana. And this was followed by manufactured cigarettes. Majority of our participants had good working knowledge of the health effects of tobacco use. So among the predictors, we had the males being twice more likely to smoke compared to the females. And we had participants who were aged 21 to 30 years being twice more likely to smoke compared to their younger counterparts, and participants who had no knowledge that smoking causes serious illness were 4 times more likely to smoke compared to their counterparts who had this knowledge. Qualitatively, several participants used mira leaves, and these were reported to be a precursor to tobacco use. So in our discussion, we noted that the prevalence of tobacco use in our study was high, and this was partly attributed to the fact that this was a slum setting that is characterized by high crime rate, high substance abuse, high drug addiction. This prevalence is way higher than the national estimates, and this needs to be attended to. So the males smoked more, and it's partly alluded to the fact that they are more alluded to peer pressure. And chibanga was commonly smoked because participants believed it had neutral health effects than when tobacco alone is used or when marijuana alone is smoked. Participants interestingly believed that marijuana neutralizes the ill effects of tobacco. And so those are things to pay attention to. So in our conclusion and recommendations, we note that more than half of our participants were tobacco smokers currently, but they had good knowledge about the health effects of tobacco. But also we noted that being male and aged 21 to 30 years old, but also being unaware that smoking causes serious illnesses, was strongly associated with tobacco use. We therefore recommend that current and feature interventions should target sensitizing the male slum dwellers about the ill health effects of tobacco. And also, myths about using chibanga should be addressed. So thank you so much. This study had some limitations. Firstly, it was a cross-sectional study. It couldn't infer causality. Secondly, the sample size was small. It cannot be generalizable to the entire population. But also thirdly, this was a unique population. These findings may not be generalized to the wider nation. So, but in a bigger study, we will have to look into this. Thank you so much. We want to give thanks to the Center for Tobacco Control in Africa for having supported this work. We are so grateful. Once the qualitative findings are finalized, we will have a very complete and comprehensive report. Thank you. Questions are welcome.
Thank you so much, Madam Joyce, for that wonderful presentation. It is actually, indeed, our informal settlements in generally the entire continent, not only in Uganda, are largely affected by the issues of tobacco, alcohol, and other drug abuse. And I think it's something that should concern every government in Africa about these issues. Now, I wish to invite our final presenter for the first half of our session. I'll invite Lungile Nkosi. I hope I'm pronouncing this name right, who's going to be presenting to us about the prevalence and correlates on roll your own smoking among South African adults. Lungile is a research associate at the university, Sefako Magato University. I hope I'm getting these names right. Yeah, she's a research associate at SMU, or Sefako Magato University in South Africa. Let's play the video, please.
Good day all. I'll be presenting our abstract titled Prevalence and Correlates of Roll Your Own Smoking Among South African Adults for the cycles 2010 and 11 and 2017 and 18. The aim of tobacco control is not only to reduce cigarette smoking, but to reduce aggregate tobacco use. Although we've seen a decline in the use of cigarettes over the past years, there has been reports of the increase in the use of other tobacco products, including that of roll your own tobacco among youth. This could be a result of tobacco product switching behavior, which is largely driven by market forces, such as low prices, easy access, and appealing flavors, as well as economic factors, such as tax imbalances. For example, in South Africa, during the 2020-2021 tax period, excise taxes on a pack of 20 cigarettes was 16.66 Rand, compared to only 5.39 Rand for a 25-gram bag of pipe tobacco, which is used for RYO tobacco in South Africa. These disparities in the tobacco, in the South African tobacco excise taxation system may encourage and perpetuate the use of RYO as a substitute product for cigarettes, particularly by youth and low-income groups. Our aim is therefore to assess changes in prevalence and correlates of RYO smoking among South Africans, and also to compare costs associated with daily use of RYO versus manufactured cigarettes. This study involved the analysis of nationally representative data of South African adults aged 16 years or older from the South African Social Attitude Survey for the years 2010 and 11 pooled, and for the years 2017 and 18 pooled. Measures included current RYO cigarette use and also RYO costs, as well as manufactured cigarette costs. We estimated ever and current use calculated overall and by socio-demographic factors. And for aim 2, we standardized consumption of cigarette packs and also converted RYO tobacco from grams to 1 cigarette pack and the annual costs were extrapolated based on cost per day and cost of cigarette pack or cigarette pack equivalents. When comparing the prevalence of RYO smoking among the subgroups between the two pooled years, we found a significant increase in RYO use among whites, those aged 25 to 34 years, those with matric or high school graduates, and those who are unemployed. Racial distribution of exclusive RYO smokers versus exclusive manufactured cigarettes in all the cycles combined showed that exclusive RYO use was more common among Black people throughout the period. For annual costs associated with daily use, the median annual cost of manufactured cigarettes was much higher than RYO cigarettes. Limitation includes the fact that face-to-face data collection together with self-reported risk behavior might include the likelihood of participants offering socially desirable responses. And in conclusion, our findings highlight the need to harmonize taxation of cigarettes and RYO. Thank you very much.
Thank you, Lungile, for that wonderful presentation. And it's indeed a great concern that the prevalence rate of roll on your own or roll your own is actually high in South Africa, and which I think it's something that should concern policymakers. It should concern health advocates in South Africa, and I believe in the rest of the continent. At this point, I wish first of all to thank all our first presenters who've done excellent job in just sharing their research studies, their findings, and at this point we know that indeed tobacco is of great concern to the continent. I would like to usher in our question and answer session, where our first presenters will respond to the questions that have been asked by our participants. Maybe I'll just go through the questions. We have about 10 minutes, 15 minutes of this question and answer session, where we'll need to respond to the questions that have been asked. Maybe the first question that I'll need to ask Dr. Dai, and I see you've already responded to it. It's about the availability of your research study. Maybe you'd want to just respond to that as.
Yeah.
I see you've already responded to it, but you can just go about it again.
Yes, I read a brief answer to the chat room, but
Sure.
Also I'd like to say that we're planning to submit this paper maybe next month in November to Lancet Global Health or Lancet Public Health, still like to be determined which journal to submit, but we're definitely going to submit our paper by the end of this year. Also, I think in November, the GB 2020 capstone paper will be released. That's release 1, so we're going to adjust for impact of COVID on most of our estimates. But I think for smoking, COVID does not affect our estimates in terms of like smoking prevalence, this kind of stuff. I don't think COVID will impact those. So release 1 should be a good resource to use once it's published, if you are interested in the results.
Okay, thank you so much, Dr. Dai. The next question is from Dr. Lazarus. He's asking Dr. Mayasoro, did you ask about affordability of e-cigarettes among the youth? Maybe you can respond to that. I think for the interest of the larger audience, I think you responded, but you can just go to it again.
Okay, thank you very much. For the purpose of this study, we actually did not ask about affordability of electronic cigarettes. And in fact, I also believe that could also be a factor that could influence use. But we were looking more towards factors such as alcohol consumption, use of other tobacco-related substances, use amongst friends, and things like that. So, but however, we conducted a review amongst major retail markets in Lagos State, Nigeria, where the study was conducted. And we found that for an average Nigerian, electronic cigarettes would be a little on the high side, such that only people who were of, say, middle or higher socioeconomic status would be able to afford it. Thank you. Over.
All right, thank you, Dr. Mayasori. Maybe a quick question back to you again is there a certain population that was perceiving e-cigarettes as a quitting aid or as a cessation aid. Would you like to highlight on that?
Sorry, please, can you repeat the question? I didn't quite get that.
I'm saying from your study, there's a certain demographic that was perceiving electronic cigarette as a quitting aid or as a cessation tool to help them to quit smoking. Would you like to highlight on that?
Okay, yes, thank you. So what we found was that of the total 51 respondents who actually attested to ever use of electronic cigarettes, about 9% of them actually had a current intention to quit. And we also found that about 19% of them had actually had a quit attempt in the previous 1 year. So I think though the total number of respondents that actually attested to the use of electronic cigarettes was actually small when compared to the total number of respondents who took the survey. But I think that comparatively, the intention to quit is a little low. However, I believe that more studies will be necessary to actually determine quit attempts and intention to quit, as well as factors that contribute to quit attempts amongst users of electronic cigarettes. Thank you. You're on mute.
All right, thank you so much, Dr. Madam Joyce, that was quite an impressive presentation about the prevalence rate of tobacco use within our informal settlements. Kindly, there's someone who's asking, in your study, how did you define tobacco smoking? That is Dr. Lazarus. Yeah.
Thank you so much. In this study, we defined tobacco smoking as having used any tobacco product within the past 30 days, and of which beyond 30 days, we termed that as ever use of tobacco. But because we were mostly interested in current use of tobacco, our focus was majorly on that. Thank you so much.
All right, thank you. Someone else is asking, Joyce, whether is marijuana legal in Kenya? And I think I'll respond on your behalf because I'm in Kenya and you're in Uganda. Marijuana is illegal in Kenya. So I hope that settles that question. Okay.
Okay, yeah, and so is it in Uganda? It's illegal. Thank you so much.
Thank you.
It's legal in Seattle, by the way.
Yeah, incidentally, the argument about the medicinal and recreation is sort of taking the space here, and our policymakers are busy discussing that. Probably now, my question to Lungile. The issue about roll-on, we saw the prevalence rate is rather high among certain communities. What do you think would be the likely contributor to that?
Thanks for the question. So it's apart from price, we couldn't find other factors. So mostly it's about the price, the affordability, basically, because it's mostly among the Black people and colored people, and also the young people, those who also not in tertiary. So you can see it's also among those who are less educated. So it's mostly about affordability. That's the one thing we could attribute the increases to.
Thank you so much for that. I'm also seeing Zira comment to Nkosi again. Agreed that there should be a greater convergence between taxes on cigarette and roll your own tobacco. Thank you, commending you for the good work in your presentation again. So do we have any other comment, any other question? Let me see. Yes, I can see some questions. A question to Lungile. I think I have one for Lungile and Joyce. A question to Lungile. Is roll your own use more prevalent than use of manufactured cigarette? If so, why?
It is not more prevalent than the use of manufactured cigarettes. Manufactured cigarettes still remain the most common in South Africa, but we have seen the increase in the use of RYO among certain groups, especially.
Thank you so much for your response. Joyce, a question to you.
Yes,
did tobacco smoking include exposure to second-hand smoke?
Kindly beg your pardon.
Oh, sorry. Okay, the question is from Stephen Nyarango Ayera. He's asking, did tobacco smoking include exposure to tobacco smoke, or meaning second-hand smoke?
It included that, but our focus was in terms of active smoking, active use of tobacco products. Yes.
Oh, okay. Thank you so much for that response. I hope that settles that. I seem not to be having any other question on that. There's a comment here, Dr. Dai. Thank you for being in the meeting, and even when it's probably sleep time for you.
Yeah,
I'm
I'm going to log off. Like 3:30 for me right now. Sorry.
All right. I'm also seeing a comment thanking everyone for the presentation. And maybe at that point, I just want to thank you all for your presentation. That was excellent work. And it's actually a tool that we can use as tobacco control advocates to push for more policy, and even for policymakers just to see the sense as to why action needs to be taken on tobacco use, and even the new products, the electronic cigarettes, and even the roll your own, the things that most policymakers tend to overlook. I think, thank you so much for the great presentation. And for any other questions, I'm sure we'll be getting, we'll still be getting in touch with you, and we'll be sharing with the presenters even after this. So thank you so much for that. So our participants, thank you so much for actively participating in that session. And I agree that it's been a very informative session. There's quite a lot that we've learned about that. And maybe I just wish to quickly skid into our other participants. We have three participants who have very interesting presentations as well. And I'm sure no one would want to miss this. So maybe I see the time is really going, but I think it will just be fair for me to introduce the next speaker, who's going to share with us on tobacco use and the risk of having non-communicable diseases in Botswana. So I'm introducing Dr. Bontle Mbongwa. She is, let me get this title correct. I wouldn't want to miss this. Dr. Mbongwa is an associate professor and the head of School of Public Health at the University of Botswana. So kindly let's play the video. Oh yeah, sure. Let's play the video. Thank you.
Thank you, Chair, for allowing me to share this presentation today on tobacco use and the risk of having non-communicable disease in Botswana. First, let's appreciate that non-communicable diseases are a global menace. NCDs kill 41 million people each year globally, and this is equivalent to 71% of all the deaths globally. And even more concerning is that 77% of all NCD deaths are in low and middle income countries. Cardiovascular diseases account for most NCDs, followed by the cancers, the respiratory diseases, and diabetes. And tobacco use is one of the major risk factors for dying from NCDs. In Botswana, we are equally concerned. Our country, with a population of just above 2 million people, is experiencing a rapid increase in non-communicable diseases. NCDs are estimated to cause about 46% of all deaths in Botswana. And this is an increase. In 2008, we were at 31%. Now, 2016 at 46%. That is quite concerning. And again, a STEP survey of 2014 showed that the prevalence of hypertension was 29%, diabetes 5%. In terms of tobacco control, Botswana is one of the highest smoking nations in the region. And this was revealed in the Global Adult Tobacco Survey of 2017, sitting at 18%. And the majority of our current tobacco users are men, and women are only about 8%, or rather 9%. Overall, adult smokers in Botswana, it's about 14%. And men, again, are leading in terms of smoking, whilst women are more of smokeless tobacco users, where the overall rate of smokeless tobacco use in Botswana is 4%. Our study intended to estimate the prevalence of non-communicable diseases in selected urban and semi-urban areas, as well as to assess tobacco use and the risk of having non-communicable diseases. Our thoughts, this was a cross-sectional study which was carried out in Gaborone, which is the capital city, Ramotswa and Kasane, which are semi-urban areas. And we essentially followed the STEP survey questionnaire of the World Health Organization. We used SPSS to analyze our data, and our study was reviewed by the Office of Research and Development of the University of Botswana, and as well as the Ministry of Health. We did carry a pilot study. The results: 320 participants took part in this study with a mean age of 39 years, plus or minus 15, and an age range of about 18 to 87 years old. And the majority of our participants were the 18 to 45-year-olds, and this is a reproductive age group, and most of the participants had tertiary education. We measured the prevalence of NCDs looking at the number of people who were on medication over the past 2 weeks. 62% of respondents took NCD medication in the past 2 weeks, and 35% had taken medication for raised blood pressure, followed by 22% for COPD and heart diseases at 20%. The respondents aged 46 years and above recorded elevated blood pressure, and diabetes was highest among women. In terms of tobacco use prevalence, 54% of our respondents smoked or used any form of tobacco in their lifetime, and 24% of our respondents were current tobacco users, and males, as always, were the most current tobacco users. Cigarettes were the most used product at 72% compared to smokeless tobacco. And interestingly, 10% of our respondents were treated nose bleeding and toothache with tobacco. So tobacco is used as a remedy. Males were 4 times more likely to have NCDs as compared to females in our study, and current tobacco users were 6 times more likely to have NCDs than non-tobacco users. And respondents using tobacco to cure toothache, nose bleeding were 3 times more likely to have NCDs. In conclusion, NCDs are high in Botswana, and current tobacco use was reported by more than a third of the participants in our study, and mostly these were males. And the respondents who used tobacco were more likely to report NCDs than those who did not. Almost all participants, interestingly, knew tobacco contributed to NCDs, and yet many people still use tobacco. And what's more concerning in our study is that tobacco was used as a remedy for toothache, and this could have implications as we keep focusing on those who smoke or use different tobacco and not necessarily on what else tobacco is used for. We recommend the promotion of culturally tailored programs targeting especially males and non-smokers to prevent tobacco use urgently, and the government should fast track the implementation of the NCD strategy and interventions to assist tobacco users to quit. And we recommend also further research in terms of tobacco use as a remedy, and tobacco cessation and treatment programs must be fast-tracked as well. And I end my presentation with this slide, especially that, the industry is targeting our women. If you're asked, I like this slide, mind if I smoke, care if I die. Thank you very much.
Thank you, Dr. Bontle. That was an excellent presentation. Indeed, tobacco is a serious risk factor for NCDs in Botswana and largely in Africa. And also the fact that you've highlighted the importance of the role of culture in tobacco control is also interesting. I think we need to incorporate culture, especially in Africa, when we are fighting tobacco and tobacco use generally. I would wish to invite our next presenter, who's Dr. Lazarus Mbulo. Dr. Mbulo is a health scientist, and he works at the US Center for Disease Control and Prevention. Dr. Mbulo will be presenting on secondhand smoke exposure inside the home among adults in 8 countries in sub-Saharan Africa. You wouldn't want to miss this. Kindly play the video.
Hello everyone, it's great to be part of the first Africa Conference on Tobacco Control and Development, and thank you very much to the organizers. My name is Lazarus Mbulo, and I'm with the US Centers for Disease Control and Prevention. Today I have the great opportunity to share with you the findings of our study on secondhand smoke exposure inside the home among adults in 8 sub-Saharan African countries. We used the Global Adult Tobacco Survey from 2010 to 2018. My co-authors include Daniel Owusu and Anna Dean, also from CDC, Krishna Palipudi and Tunisia Smith from Substance Abuse and Mental Health Administration, Faustin Williams from the National Institute of Health, and Hadi Mahmoud from East Tennessee State University. First, a disclaimer. The findings of our study do not in any way represent any official position of the CDC, Substance Abuse and Mental Health Administration, National Institute of Health, and East Tennessee State University. The background. Secondhand smoke exposure causes disease and death in adults and children. Globally, it's estimated that 1.2 million individuals die each year from exposure to secondhand smoke. The evidence has shown that exposure to secondhand smoke occurs at home and in public places. Therefore, the home becomes one of the major places where we can be able to protect both adults and children from secondhand smoke exposure. The aim of our study was to examine the magnitude of exposure to secondhand smoke at home in the 8 sub-Saharan African countries, and also to examine the risk factors that are associated with exposure to secondhand smoke in these countries. In terms of methodology, we used the Global Adult Tobacco Survey for these 8 countries. The surveys were done independently from 2012 to 2018. The countries include Botswana, Cameroon, Ethiopia, Kenya, Nigeria, Senegal, Tanzania, and Uganda. We defined adults in this survey as adults as somebody aged 15 years or older. In terms of analysis, we conducted descriptive statistical analysis to provide estimates on the prevalence of exposure to secondhand smoke at home. And then we also conducted a multivariable logistic regression models for each country, controlling for social demographic variables to determine factors that are associated with exposure to secondhand smoke. In terms of results, overall, we found that the median prevalence of exposure to secondhand smoke at home was 13.8% across all the countries, and this ranged from 6.6% in Nigeria to 21.6% in Senegal. Using the multivariable logistic regression analysis across all the countries, we found that exposure to secondhand smoke was strongly associated with living with someone who smokes, not believing that secondhand smoke exposure causes serious illness, and having been exposed to secondhand smoke in public places in 6 of those 8 countries. Lower education attainment was associated with exposure to secondhand smoke at home, especially in Kenya, Ethiopia, and Tanzania. And lower wealth index was associated with exposure to secondhand smoke in Uganda, Senegal, Botswana, and Tanzania. Being male was also associated with exposure to secondhand smoke in Senegal, Botswana, and Tanzania, and those living in rural areas were strongly associated with exposure to secondhand smoke at home in Cameroon and Nigeria. The key findings from our study is that exposure to secondhand smoke at home is prevalent among the 8 countries, and we found that in 7 of these countries, over 10% of adults are exposed to secondhand smoke at home. Secondly, the second key finding is that exposure to secondhand smoke is strongly associated with living with somebody who smokes. And then the third key finding is that despite the variation across the 8 countries, exposure to secondhand smoke reflects disparities across education and wealth index. 2 key limitations for our studies. We use self-reported data, which might introduce some bias from the respondents. And secondly, we use data for countries that were conducted at different time periods, from 2011 Nigeria to 2018 in Tanzania. So that makes it a bit difficult to be able to compare across countries. In conclusion, we can say that exposure to secondhand smoke is prevalent. Exposure to secondhand smoke at home is prevalent in the 8 sub-Saharan African countries. And mostly it's associated with living with somebody who smokes, and also the disparities in education, wealth index, living in rural areas, This suggests the need to develop intervention strategies that will help to prevent exposure to secondhand smoke at home. And these strategies can include adoption of smoke-free rules at home, encouragement of adoption of smoke-free rules at home, adoption of smoke-free policies in public places, because this normally translates to adoption of smoke-free rules at home, creating awareness about the dangers of secondhand smoke exposure, and also providing cessation support for people who smoke. Thank you very much.
Thank you, Dr. Mbulo. That was a really informative study. And given the prevalence rate of secondhand smoke at home, there is a need for serious consideration of adopting smoke-free policies, and also just raising awareness among, because at home, mostly people get exposed to secondhand smoke because they are not aware of the dangers. So raising awareness about the dangers of secondhand smoke is also important. So thank you so much for that wonderful presentation. Indeed, it's an eye-opener, and I can even see my country, Kenya, has been highlighted. And I think we need, as a continent, we need to address the issue of secondhand smoke authoritatively. Thank you so much. My next presenter is Professor Marie Chan Sun. She's an associate professor at the University of Mauritius. She'll be presenting about novel tobacco products, a cause for concern amid the emerging global concern. Kindly, let's play the video.
Hello, this is Marie Chan Sun for the oral presentation on novel tobacco products. As a word of introduction, I will refer to the Global Youth Tobacco Survey, which revealed that the current use of electronic cigarettes in Mauritius was 11% among students aged 13 to 15 years. Nonetheless, the import and sale of e-cigarettes are not allowed in Mauritius. This was thus a cause for local concern. There was a need to grasp the magnitude of the problem. This study was thus designed to probe in the sale of novel tobacco products in Mauritius. For the methods, we used a qualitative approach which consisted of structured observation, desk research, online search, as well as face-to-face interviews with the sellers to explore the availability of NTP on the local market. All the 10 sale outlets which were identified were considered for the purpose of this study, which was approved by the Ethics Committee of the Ministry of Health and Wellness. Considering our findings, this study confirmed the availability of e-cigarettes in various shops in several localities in Mauritius. It showed the availability of shisha pens in different flavors. It also uncovered the online advertisement via social media platforms and home delivery service with discounts for bulk purchases. No heated tobacco product was available on the local market at the time of this study. This first qualitative study on NTP in Mauritius contributed to the constitution of baseline data, although we do acknowledge the fact that some shops were not operational because of the COVID-19 pandemic. It is important that we realize that the sale of NTP in electronic shops is a calculated strategy to attract young people to use NTP. There is thus need to develop school evidence-based interventions and other sensitization campaigns targeted to the youth to raise awareness on the harmful effects of NTP. There is also need for strict enforcement of the ban, which already exists on the import and sale of e-cigarettes in Mauritius. Here, we highlight the role of policymakers in Africa with respect to advocacy work for the implementation of policies to ban the manufacture, import, and sale of NTP with a view to saving the young generation from the tobacco industry tactics. Reaching the end of this presentation, we acknowledge funding from the Association Visa for this research study. Thank you for your attention.
Thank you, Professor, for that wonderful presentation about novel and emerging products. This is a great concern for the continent because these appear to be the new new trend in the continent. And I think it is something that most tobacco control advocates and policymakers must be keen on. I would wish also to call upon the participants to ask questions. You feel free to ask your questions on all the presentations that we've had. And I would also like to encourage our presenters to also engage on the chat session as possible. And Professor Marichan was our last presenter on that session. And I would like to usher in another session for question and answer. And maybe I'll also need to rope in Joyce Nachitende, who was on the first session, maybe just to respond on one burning question. I see it's burning, but we can also invite all the other presenters to respond. Maybe to start us off, Joyce, I'll start with you. Pamela Mawanda has a question. She's asking, why is Kibanga more popular than just cigarettes? And might its popularity have something to do with intoxication levels? Maybe you can respond to that quickly, and then we can get to the other questions.
Thank you so much, Pamela, for this question. Chibanga, just to reiterate, it's a local term used to mean a mixture of marijuana and tobacco. So in this study, it was a mixed method study. We followed up with some qualitative interviews, and our findings preliminarily, participants really they had that belief that when they mix tobacco with marijuana, because they have seen these images of rotten lungs, distorted body features, so they believe that marijuana has some medicinal properties. When mixed with tobacco, that mixture is kind of not as harmful as when tobacco is used alone. So this product was actually very, very common in this population. And about the intoxication levels, perhaps it's not an area that I ventured into for this particular study. Later, we might find out whether it has something to do with intoxication in later, really. Thank you so much.
Okay, thank you so much, Joyce, for that. Now, my question would go to Dr. Mbulo, sorry. You highlight, by the way, thank you so much for that presentation. You highlighted about secondhand exposure at home being significantly associated with the lower education attainment. Would you like to delve a bit deeper on that?
Sure, thank you very much. That's a very good question, actually. So what we notice is that most people with lower education, no formal education, primary education, tend to have high exposure to secondhand smoke. Some of the studies have shown that that could be contributed to poor understanding of the dangers of exposure to secondhand smoke. And part of it is also the living environment. Some people live in a small, crowded environment, so they're more likely to be exposed to secondhand smoke. So it's a health disparity issue. And so that really calls for actions where we have to target people. We have to focus interventions that help people in low income or poor education. First of all, educate them about the dangers of exposure to secondhand smoke. And secondary, support them with cessation and support them with interventions to help them to adopt smoke-free rules in their homes.
Thank you so much, Dr. for that. Prof. Marichan, sorry. There's a question. Let me just read it. It seems a bit longer. And I also see you've responded to it, but I think for the sake of the larger audience, I think it would be good to just share. If the import of e-cig is not allowed in Mauritius, are the shops selling these products not illicit? Sounds like contradiction in policy, unless she's missing something. Let's go. Would you like to respond on that?
Yes, I confirm that the import of e-cigarettes is not allowed in Mauritius. So the sale is illicit. So there are shops who are not abiding, they are not complying with the law. So this is why the Association Visa led this study, because we want to raise awareness among the authorities that this is an emerging issue and that we need to be vigilant about the sale of these illicit products. We want to draw the attention of the authorities that although the law has been passed for the ban on the import and the sale of these novel tobacco products, that there's need for enforcement. So this is the advocacy work that we are undertaking in Mauritius, and we'd like to share with the African colleagues that we need to be vigilant with regard to the ban on these novel products, which is definitely a threat for the continent.
Thank you so much, Prof. Thank you so much. I think it's important raising the awareness level of the policymakers. I think it's very important to inform positive action towards these products. I think thank you so much for that. I'll also need to, Dr. Mbulo, there's a comment or a question for you here. Generally, secondhand exposure at home in the African countries is lower compared to some other regions. Part of this is that the current smoking rate in African countries, according to GATS, is quite low. Do you agree with this sentiments?
Yes, part of it, what we have observed, like I said, we have done GATS in 8 countries. There are 2 more countries coming up, South Africa and Mauritania. So what we have seen, what we have observed, also some other surveys have also indicated that smoking rates in African countries is quite low. But the significant thing we need to know is that it's on the increase. Part of it is the tobacco industry targeting African countries and other low-income countries. So because the smoking rate is quite low, so what we have seen is also exposure to secondhand smoke at home tends to be low, but it's something that we need to take into consideration. Okay, currently there's prevalence of exposure to secondhand smoke at home, and with the increase in smoking rate, we might see a bit more of that. So I think we're at a critical point where we can be able to start to raise awareness and to encourage people to adopt smoke-free rules. Compared to other regions, we've seen that smoking rates are quite high and exposure to secondhand smoke is quite high. So I think it's really critical for African countries to observe that although it's low in terms of smoking rates now, and the exposure to secondhand smoke is low, but if you look at some of the evidence, especially like smoking rates among the youth, it's quite high, and these will be the future adults. So we might see high smoking rates among adults, and so that might also impact the exposure to secondhand smoke at home. Thank you.
Thank you so much, Dr. Mbulo, sorry. Indeed, there's a lot that needs to be done on exposure to secondhand smoke, especially in the continent, because I know
I think we've got an internet problem here.
Yeah, it's frozen.
Yeah.
Yeah, so maybe to just build up on exposure to secondhand smoke, the other thing is we have seen a lot of countries in Africa now passing smoke-free policies. And Uganda is a very good example, Ethiopia as well. So encouraging countries to adopt smoke-free policies, I think it's critical, because when we have smoke-free policies in public places, people also start to adopt those policies into their home. They want to protect their families, they want to protect their children at home as well when we see it in public places. So I think that's one of the critical things as well when we start to look at exposure to secondhand smoke.
So I've just, so thank you. So I've just seen a question from the chat box for me. So I'm going to reply to this question. So as a matter of fact, e-cigarettes are not allowed in Mauritius. The conventional cigarettes, the conventional tobacco products are on sale in Mauritius, but e-cigarettes are not allowed. And there's also all the water pipe tobacco products are not allowed. Although the sale of water pipes is allowed, but the tobacco products for use with water pipes is not allowed.
Yes, I agree.
Thank you.
Sure. And then get back to the question of enforcement. I think part of what we have seen in terms of smoke-free policies, it's really educating people about the dangers of exposure to secondhand smoke. So educating and making people aware before we do the enforcement. So what countries have done is to educate people about the dangers of exposure to secondhand smoke and then pass policies. So it will be a self-regulating, self-monitoring. People are aware about the danger of secondhand smoke exposure, so we don't have to wait for the police to be policing people, that they adopt smoke-free policies. So as long as people are aware that exposure to secondhand smoke is not good for the children, it's not good for everyone, then there'll be that self-policing and self-awareness. And so that will be important to help the adoption and enforcement of smoke-free policies.
Well, thank you so much, Dr. Ari. My apologies. We have some blackout in the office.
Okay.
but I'm back now. Probably this would be a question to both you and Professor Chan. Enforcement levels in Africa is a problem. So how do you think this can be addressed? Probably this is the last question that I'm seeing here. That enforcement seems to be a problem. Now, how do you think? What interventions do you think can be put in place for the African countries to address enforcement issues?
Yeah, definitely for Mauritius, we should say that the law has been passed and it has been well written. The law has been well, there are articles which specifies clearly what's allowed and what's not allowed. So we are really abiding by the FCTC with regard to the passing of a law, the implementation of a law. But the part which is most challenging for Mauritius, and I think other African countries will face the same situation. The most challenging part for Mauritius has always been since we have signed the FCTC has been the enforcement. But now we are working on how to train people, and we are advocating for the recruitment of a new team of enforcement. This is what we are advocating, that there's need for enforcement teams, especially for tobacco control, and not depend on the police force to do this job of maintaining the law with regard to the tobacco control law.
Yes.
Thank you so much.
Sure.
Doctor, any input?
Sure. So I'll talk more on secondhand smoke. So there are policies that are passed to protect people from secondhand smoke, and mostly it's public places. But at home, it's more of a self-decision, personal decision to make your home smoke-free. So I think in terms of enforcement, when it comes to smoke-free policies, I think it's about educating people. What happens generally is we pass these policies at Parliament, at that high level. But we need to educate people about the dangers of exposure to secondhand smoke. So once they understand, then they can be able to even apply it to their own home. They can even be able to ask somebody not to smoke in a public place. So it can be self-enforcing. If you think most countries' smoking rates are like less than 10%. So there are very few smokers. There are a lot of non-smokers. So if a lot of non-smokers understand the dangers of exposure to secondhand smoke, if somebody smokes in a place which is not allowed, they'll be able to stand up and say, excuse me, please, you're not supposed to smoke in this place. So it's part of it, making people aware and self-enforcing. So we don't need to recruit more police to enforce. But if people understand, then it can be self-enforcing. Thank you.
So I agree with you, Lazarus. With regard to the smoke-free policies, definitely we need to do the health education about the dangers of secondhand smoke and empowers people to be more assertive, to ask smokers to stop smoking by the law. So I agree with you. I share the same opinion. When I was talking about the enforcement, it was rather with regard to the sellers, the shops who are not complying with the law.
Yeah, I think when it comes to the sellers, if they are sold in those stores which are registered, so those should be easy to monitor. One of the things countries have done is to have education also for storekeepers, for owners of stores, about the dangers of selling this, about the risk, about the law, about selling illegal products. So you make them aware, and then if you do the enforcement, at least they are aware there's a law which restricts the sale of e-cigarette, restrict the sale of these particular products. And then, so enforcement will also be more effective because they are aware of this. And then you can also put, some countries have actually put a penalty on the owner of the store and also the shopkeeper, the person working in the store. So there's like a double penalty. So the owner of the store will have that responsibility to make sure that their workers don't sell illegal products. Or the workers also make sure to tell their owners that I can't sell this product because it's illegal. Thank you.
Thank you so much. Indeed, that was a very insightful session. Indeed, it was very informative. There is a role to play for everyone to play. The role of policymakers. There is a role for citizens to play. There is a role for everyone to play, indeed, to ensure that enforcement of tobacco control policies is properly done. And even the policymakers have an equal role to do much of what they're supposed to do to protect the citizens from the dangers caused by tobacco and involuntary exposure to tobacco smoke. The gentleman and lady, thank you so much for that wonderful presentation. Thank you. I would like to thank all the presenters for the wonderful presentations that they've done. Indeed, we've learned quite a lot on generally tobacco control in the continent of Africa. And at this point, I would just wish to end this session by saying a very big thank you to all of you and also to the participants for actively participating in this wonderful and engaging discussion. Thank you so much.